So friends, let us begin with this session, and the session is ranibizumab, the versatile antivascular endothelial growth factors. Well, it's more than a decade that we had anti-VEGF available with us. I remember when I initiated my fellowship program, and we used to get a cases of age-related macular degeneration. So a weight variant of it, we would say that we cannot do much. Then came the lasers, where we started lasering these particular membranes and ending up with a scar, with a consolation that we could prevent further visual loss, but for the recurrences. So that is the way it started. And then came the pharmacology for the rescue of vitreoretinal surgeons. Initially came the steroids, and I'm thankful. Okay, I do welcome Dr. Arnab Das and Mahesh Gopal Krishnan to be with me over here. So, Talwar sir, you can meanwhile load your presentation on number 1. So when macular anti-VEGF came, it came in a big way. Initially, the prices were quite high. They were really restrictive in means, for the routine practice in our Indian context. And from there, it has moved. The prices have come down. They have become competitive, and they have become affordable to the most of the patients. And that is how this was the second anti-VEGF which had become available to us, and we started speaking for the patients that we can improvise the vision. Not just, we were never on a defensive henceforth. We became more aggressive, we thought about, and we started speaking about improvement in the vision, the quality of vision as well. Now we have a big bucket list of, I should say, of anti-VEGFs, but in spite of that, even now the ranibizumab, which was the originator molecule, is holding the sway and is holding the major market share. And why? Basically because this is the original research molecule which has been introduced. For the first time, it's more of a target specific thing. And that's why in this era, when there are so much of competition and other anti-VEGF molecules working through other mechanisms, it is still holding the sway. So let us hear through some of our speakers how this molecule helps us out in various diseases like AMD, diabetic macular edema secondaries to any vascular retinopathies, and sometimes tumors as well. So without much ado, I would introduce you to my panelist, Dr. Mahesh Gopal Krishnan, who is from Kerala, Cochin. He is a senior vitreoretinal surgeon at Girdhar Eye Institute. And my next co-panelist is going to be Dr. Arnab Das from Kolkata. So may I take this privilege to introduce Dr. Diresh